Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about ulcerative colitis. In particular, I will cover what is ulcerative colitis, how you treat ulcerative colitis, and how you can better live with ulcerative colitis. So we start with what is it? Ulcerative colitis is an inflammatory bowel disease, or IBD, that causes chronic inflammation of the digestive tract. Ulcerative colitis is characterized by abdominal pain and diarrhea. Like Crohn's disease, another common IBD, ulcerative colitis can be debilitating and sometimes can lead to life-threatening complications. So symptoms can flare up and then go into remission or disappear for months or even years. Ulcerative colitis usually affects only the innermost lining of your large intestine, or the colon, and rectum. It occurs only through continuous stretches of your colon, unlike Crohn's disease, which occurs in patches anywhere in the digestive tract and often spreads deep into the layers of affected tissues. So the symptoms of the condition can vary depending on how much of the colon is affected and the level of inflammation. So the common symptoms include abdominal pain and bloody diarrhea with mucus. There may also be tiredness and fatigue, loss of appetite and weight loss, anemia, fever, dehydration, weight loss, and a constant desire to empty the bowels. Symptoms are often worse first thing in the morning. Many people living with the condition will have long periods of or months or years where they experience very few or no symptoms. However, in all cases, without treatment, symptoms will eventually return. No specific trigger that causes the return of symptoms has been identified, though it is thought that stress may play a factor. The exact cause of the condition is unknown, but researchers believe that there are a number of factors involved, which include a genetic factor. It seems that the genes we inherit from our parents play a role in developing the condition. And in environmental, the evidence for this is that the condition is much more common in urban areas in northwest parts of Europe and America. In the immune system, some researchers believe that a viral or bacterial infection triggers our body's natural defense system against the infection. The immune system. The immune system responds to the infection by causing the inflammation associated with ulcerative colitis, but for some reason the immune system does not turn off once the infection has passed and continues to cause inflammation. Ulcerative colitis affects about the same number of women and men. Risk factors include age, so ulcerative colitis can occur at any age, but ulcerative colitis often affects people in their 30s. Your race or ethnicity. Although whites have the highest risk of the disease, it can occur in any race. In family history, you're at a higher risk if you have a close relative with the disease. And Roaccutane use. Although cases and cause and effect hasn't been proved, studies have reported the development of inflammatory bowel disease with Roaccutane use. Non-steroidal anti-inflammatory medicine. Although these medicines haven't been shown to cause ulcerative colitis, they can cause similar signs and symptoms. So next is how you treat ulcerative colitis. The goal of medical treatment is to reduce the inflammation that triggers your signs and symptoms. In the best cases, this may lead not only to symptom relief but also to long-term remission. Ulcerative colitis treatment usually involves either drug therapy or surgery. Anti-inflammatory drugs. So the anti-inflammatory drugs are often the first step in treatment of inflammatory bowel disease, and they include sulfasalazine, which is salazopyrin, asacolon, pentasa, mezavant, salofac, and dipentum. Also corticosteroids and immune system suppressors. These drugs also reduce inflammation, but they target your immune system rather than treating inflammation itself. Immunosuppressive drugs include Imuran and purinatol, azathioprine, and mercaptopurine. They're the generic names. You have Nerol, which is cyclosporin, infliximab, which is Remicade, and surgery. So if diet and lifestyle changes, drug therapy, or other treatments don't relieve your signs and symptoms, your doctor may recommend surgery. And finally, how do you live with a diagnosis of ulcerative colitis? Though diet seems to play no role in causing ulcerative colitis, it can play an important part in helping control the condition. The following advice may help. Keep a food diary, eat small meals, drink plenty of fluids, food supplements, and manage your stress, exercise, and use relaxation techniques. And finally, there are numerous products available at Lynch's Pharmacy in Douglas and Cork to assist you managing ulcerative colitis more effectively on a day-to-day basis. So to start with, we have numerous products to get you up and running on an exercise program. So we have exercise bowls, floor mats, weights, and other items you need to get yourself started on a program. We also have various supplements and products which you can purchase from us without prescription, such as probiotics, multivitamins, laxatives, calcium supplements, if avoiding dairy, and anti-diarrhea medicine, psyllium husk fibre, vitamin A, and we have light boxes to promote relaxation, blood pressure monitors, and blood sugar monitors to manage your illness. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding and knowledge of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing ulcerative colitis with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas in Cork or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.